From itchy bits and sweaty boobs to floppy you-know-whats. We've all been there. It's time for a segment we're calling Taboo Talk, Your Bits, Our Business, where we get honest about the parts of our bodies no one wants to talk about, but really should. Research from the Nursing Times revealed that nearly 40 million people in the UK have delayed visiting their GP over something they consider to be embarrassing. One of the areas I'm most passionate about is the vulva. Now, that's medically speaking. Now, I've got to say that a lot of patients come and see me, and I have a big female patient group, and they come and see me, and they've delayed coming to see me because they're embarrassed about it, and they have something on their vulva. Now, lots of people haven't even heard of the vulva or know what it is. Basically, it's the whole outside part of the female genital tract. So everything you can see is the vulva. The inside bit, that little bit that goes inside, that's the vagina. So the vagina isn't the outside part, it's the inside part. Now, what I want to say to all women watching this is there's nothing embarrassing about your vulva. Use that word vulva. Don't call it anything else, it's anatomical. But particularly after the menopause, any changes on the vulva, whether it's a colour change, a skin texture change, a sensation change, you must always get it checked by your doctor, because vulval cancer is something lots of people haven't heard about, but is a real thing. And it doesn't have to be vulval cancer. It could be other skin conditions. There's something called lichen sclerosis, which you know all about. It's a chronic skin condition, isn't it? But also, after the menopause, any new vaginal discharge. This is something else that catches out a lot of ladies. New vaginal discharge after the menopause, they put it down to thrush, they put it down to hormonal changes, they get some treatment from the chemist, it might come and go, they think it's nothing, but it could be a sign of womb cancer as well, couldn't it?
It can be, and there's so many areas of the vulval anatomy, our genitalia, because we actually have the urethra where we pee from, we've got the vagina as well, and then the perineum, which is the gap at the bottom, between the bottom of the vagina, the vulva, and the back passage, and then we've got the perianal tissue. So we've got three holes which can all be affected. And as you mentioned, that there are skin conditions like vulval lichen sclerosis, which are chronic and lifelong inflammatory conditions. The youngest I've diagnosed is actually 4 years old. So we always think of something that happens to much older people. Then we can also, as we get older, and particularly when we've had children as well, because of hormonal changes and the microbiome in the vulval vaginal area, get something called atrophy or genitourinary syndrome of the menopause. There's a really small area of women who put up with an itch or a thrush or recurrent urinary tract infections. Particularly, we see this in breastfeeding mums, and that's known as genitourinary syndrome of lactation. And urinary tract infection symptoms, so there's horrible UTI symptoms where it burns and it stings. There's going to be an underlying reason to that, and we need to find that. So not just grab the antibiotics or the cystopurinol or the anti-thrush cream off the counter, because a lot of women, there's that embarrassment factor, who am I going to see? But because it's so common, common isn't normal, but we put up with it and we self-treat ourselves, and you've seen that as well.
Oh, yeah, I mean, I've seen people who have actually attended and seen doctors, seen nurses with things like lichen sclerosis, and just been treated for thrush again and again and again, and left untreated and you know, for a long period of time, it can actually completely change the architecture of the vulva. People can get fissures, people can get, you know, where the labia have sort of fused together, and I've seen that, and it's really, really sad.
And it takes a long time to diagnose, because I have the condition, and mine was picked up actually after years and years and years. But it took me a year on the NHS wait list to go and get it, because I had a tear, a birth injury after having my first and second. And that also is the time when it triggered off for me. But even though I'm a doctor, I remember going, I really don't know who's going to examine me. And I had to then put my big girl pants on, go, I don't care, I need to get this sorted, because there is that fear factor. But it's good that lots of women feel comfortable with you.
I think it's really important that women feel empowered to go and see the doctor. Who are they going? They're embarrassed, so they're thinking, what am I going to tell the receptionist first of all? And my tip when you're talking to the receptionist is you don't have to tell them specifically what's wrong. The receptionist is trying to guide you to the right person. So broaden it out. Say, it's a gynecological issue. That covers many, many bases. You don't have to be so specific. That's not embarrassing. And then do you want to see a male doctor or a female doctor? You can ask the receptionist what your preference is. And for some people, you prefer to see a man, others will prefer to see a female doctor. And usually, if it's in a practice with several doctors, you can get to choose who you see.
And you can always get a chaperone as well.
Absolutely, you'll get a chaperone. You can and take somebody with you for moral support if you feel that would be helpful.
So our message today is Get to know your vulva,
Yes.
know what's normal for you, what's abnormal. When you check your boobs once a month, which you should be doing, check your vulva as well. So lots of people may not know how to do it. Nigga,
I'm
you're
going
going to talk us
use
through
one
it.
of these firstly. OK, this bit. OK, so a mirror with a long handle, and Amir's going to show us his vulva.
And Zoe.
So Amir is going to show somebody who's got probably not that great dexterity. Zoe's going to have better dexterity and flexibility. But what you need to do is sit on the side of a bathtub, at the end of a chair, anywhere basically where you've got a bit of a ledge, and then you can then use the mirror between your legs, and you want to get it in between your legs. And when you've got it in between your legs, you want to spend a good time looking at it. Yes, get to know your vulva very well. You want to look at any skin changes, any rashes, any lumps and bumps, any new moles or any ingrown hairs that you might want to do, any scars from anything. Then with your free hand, you want to use your fingers and go in between the labia. So part the labia. So the labia majora, the labia minora, and you want to then have a look at your urethra. So firstly, have a look at the clitoral hood, where the clitoris is. Follow down, you want to find your urethra, which is where you wee from. Then you want to have a look at your vagina. And then you might want to just see if there's any changes around the vagina. And yeah, lean back if you want to. You can even put your legs akimbo. That really does help as well. And you want to follow that skin down to the posterior fourchette and then the perineum as well. So it's so important because actually vulval cancers and also anal cancers can happen. We miss our anal area, so you need to really look at the anal tissue. So if you can get it between your legs, the other tip is if you want to stand, so that would be good, is then to part your lips and then have a look. And Zoe's going to demonstrate, but you can squat as well. So if you've got flexibility, that's it. See, I mean, she's a pro, isn't she? You can squat. You can squat and then have a look, because no one is going to know your skin better than you, and then track your changes. And this is a sneaky bit that you could do. You could take photographs, but keep them very private to yourself, because then you can share that with your doctor. But yeah, that's how you should do it. Whenever you're checking your boobs, check your vulva.
Very good.
Out of interest, members of the audience who have a vulva, who checks their own vulva? Some of you putting your hands up. Brilliant. Great.
Yeah, that is so good to see. And I just want to add, it's so important to have a feel between the groin area for any lumps. So lymph nodes in that area, that just completes the whole examination.